started. And here is your question. Tell me once you've read this, there's a little bit on the next page. Read it? Yes.
Yes, ma'am.
Just the question was written on the next page. Right. So if you have read and understood, considering it critical care scenario, kindly tell me, how do you plan to manage this patient now?
Since this patient is in critical condition, I have to manage according to the CRISP protocol,
Okay.
following the ABCD protocol. Because if the patient is conscious and talking, then I will consider the airways patent. Then for breathing, I'll look, listen, and feel. And for circulation, since the patient has hypotension and tachycardia, probably patient is in shock. So I have to correct I have to open 2 wide bore cannula and consider for circulatory support by starting IV fluids, crystalloids.
And
then
please continue.
Patient should be kept in proper position. And
why do you
also
think
we have
patient
to,
might
since
be
patient is taken,
dehydrated?
we have to start.
Sorry.
Patient might be dehydrated because of
yes, fluid being squeezed out of the third space.
Yes, because of the sequestration of fluid in the third space.
Yes.
Space loss.
Since patient is in pain, how do you intend to manage the pain of the patient?
For the pain, I have to manage according to the WHO pain ladder.
Yes.
Whereby I'll start with initially with non-opiates like paracetamol or ibuprofen. Then I'll go to weak opiates like codeine and all. Then if that doesn't work, then I'll go for stronger opiates like morphine.
Okay. Why do you think, what is the diagnosis or the differential diagnosis that you'll consider for this patient?
For this patient, my provisional diagnosis will be acute relapsing pancreatitis. I will also consider acute cholecystitis, ascending cholangitis, or perforated viscous, and also pancreatic pseudocyst.
Okay. Right. Why do you think, okay, what would happen if you don't manage the patient on time? What are the complications that you expect to find?
Yes, complications can be local or systemic. In case of local, the patient may develop hemorrhage or necrotizing pancreatitis. Patient can develop fat necrosis, abscess, phlegmon, or patient can develop pseudocyst or splenic vein thrombosis. In case of systemic, patient can develop.
How does acute renal failure take place? How does acute renal failure takes place in the patient with acute pancreatitis? Can you please tell me the mechanism behind it?
First thing, it could be because of the dehydration and circulatory failure, whereby there is decreased renal blood flow.
Okay.
And reduced GFR. And second could be because of sepsis, if patient develops sepsis.
Yes, very good. Okay, pancreatitis can be diagnosed considering several criteria. Can you name few?
Yes, ma'am. There are certain criteria we can use. We can use Glasgow criteria. We can use the Ransom criteria. We can use the belt hazard. We can use the Apache 2 score.
Can you please tell me about the Glasgow criteria?
Yes, Glasgow criteria. We have partial. We have certain parameters like partial oxygen, which is less than 8 Kelvin Pascal. Age more than 55. Then neutrophil more than 15,000, and the calcium less than 2 millimole per liter. And in case of kidney, we have to look for urea, which is more than 16. And in
How much should
we
be
have to also
albumin?
this
Yes.
LDH should be more than 600.
Yes.
And
And
albumin should be less than 3.2
yes.
gram per deciliter, and
Yes.
sugar should be more than 10 millimole.
All right.
And
Can
here
you-
the diagnosis should be at least 3 of the above.
Above. All right. Very good.
3
Can
of
you
the
please
above will
tell
need,
me
sir.
why this patient was tachypneic?
Tachypneic, it could be because of pain, abdominal pain, and it could be because of complications like ARDS. The patient develops ARDS, or it could be because of the pancreatic pseudocyst, if it is large enough to cause pressure.
Normally,
Or
patients. Yes.
If it splints the diaphragm.
Okay, yes, that's the most important one. Normally, patients with acute pancreatitis presents with hyperglycemia. Can you tell me why?
Yes, in acute pancreatitis, the pancreatic enzymes, they can destroy the beta cells of the islets of
Yes.
pancreas, and thereby there's defective insulin secretion, which can cause hyperglycemia, increased blood glucose.
They say, okay, you told me already, but I want to know what are the radiological investigations that you could do in pancreatitis or acute pancreatitis?
We can do, firstly, we can do ultrasound.
Yes.
Then also we can go for CT scan of the abdomen.
All right. Okay. What are the advantages of doing CT scan in patients with acute pancreatitis? It helps
CT scan,
yes.
we can see any local complications.
Yes, like
any necrosis,
yes.
any collection,
okay. Yes.
any abscess or pseudocyst.
Very good. What is pseudocyst?
And also helps us in the management plan.
Can you define
pseudocyst? It is a focal fluid collected space, which is lined by granulation tissue, which doesn't have a true epithelial lining. That's why it's called pseudocyst.
All right. Can you tell me how pseudocyst can be managed?
Pseudocyst, it depends on the site, duration, and size. If it is smaller in size and if patient has mild symptoms, then it can be managed conservatively. Okay. But if the duration is more than 6 weeks, size is more than 5 centimeters,
yes,
and patient has thick cyst wall, then we can plan for drainage.
Okay.
And certain options of drainage are, we can go for
what are the complications that you can expect if you don't get to manage pseudocyst on time?
Yes, the certain complications of pseudocyst, if not managed, can be there might be infection. Patient might develop abscess. There might be hemorrhage. It might be rupture. There might be due to the swelling. There might be CVD obstruction. It can also lead to portal vein thrombosis.
Very good. What are the blood tests, which are important for the diagnosis of acute pancreatitis?
Acute pancreatitis, first of all, we have to do full blood count, urea electrolytes, and certain
Just to the point, tell me, what are the important
specific-
blood tests?
okay,
Yes.
serum lipase and amylase, ma'am.
All right. Okay. Contrary to that, which blood test is important for the diagnosis of pseudocyst? Just serum amylase.
For pseudocyst, amylase, ma'am.
Yeah, very good. Good. Yeah. Okay, anyone want to give feedback?